0971. Call the office at 572-0383 or 572-0215. REV-UP St. Lucia, the alpha of radio.
It's now time for Doctor in the House, live with Dr. Leonard Surage, brought to you the compliments of La Place Salazar, Jeannot Cooperative Credit Union, and Tapia Hospital.
At Tapia Hospital, caring and competent obstetric consultants will see you safely from prenatal care through delivery with a team of excellent pediatric and anesthetic support. Tapia Hospital, where the patient safety comes first.
In the heart of St. Lucia, where mountains meet the sea, there's a story of resilience, community, and a promise kept for over 50 years. Jeannot Credit Union has been a pillar of support and a friend. Together, we've weathered storms and celebrated triumphs, from sponsoring local events to supporting education. Our motto, together we can move mountains, isn't just words. It's a commitment to unity, progress, and shared success. Feel the pride, the belonging, and the warmth of a financial partner that cares. Join us and be part of something extraordinary.
It's delicious.
La Place Salazar is the true home of quality meat and deli products, selected and priced to suit every palate and pocket. We sell all cuts of meat, poultry and fish, from tasty lamb necks and succulent pork chops to lean dolphin and juicy top round steaks. Our deli items include turkey, ham, bacon, pork sausages, meat patties, chicken nuggets, deli ham and eggs, so that breakfast or that party is a breeze. And for your added convenience, we sell restaurant essentials and grocery items. So where's your next meal coming from? La Place Salazar, of course. La Place Salazar, Castries, Grosley, Beaufort, and Soufrière.
It's delicious.
Well, Doctor in the House is now with Dr. Leonard Surage, live on REV-UP St. Lucia. Dr. Surage, a very good evening to you. Always good to see you.
Good. Thank you very much, Andre, and listeners and viewers. Thank you very much for tuning on. Once again, Tuesday, Doctor in the House, and I, Dr. Surage, will be taking you through that session. Today is Tuesday, the 10th of February, 2026, and if you may recall, a few weeks ago we had cancer, it was Cervical Cancer Awareness Month. That was January. Now this month, February, we have another awareness program, and that is the World Health Organization has deemed February the Cancer Awareness Month. By cancer awareness, it's bringing cancer to the forefront of discussion. I may have talked about cancer before, and I'm sure I have done in a different setting. However, I think that this time around, I'll not be looking at individual cancers as such, but I'll be looking at it in a more open or global generalized perspective. Let me put that in action. Every part of the body can form a cancer. And a cancer is nothing more than a part of the body that is growing without control. It cannot control itself because the body has its own mechanism by which the body heals, and when the healing is finished, it stops growing. However, with a cancer, as if it doesn't know how to stop growing. So any part of the body that actually is alive will form a cancer. And so one ought not to be petrified by the word cancer. As a matter of fact, the topic I am going to talk about, the part of cancer, is the misconceptions associated with cancer. And for example, people would say, well, if they have cancer, then that's a life sentence. That may not be so. Not all cancers can be cured. However, there are a lot of cancers that have been cured. And the real issue is the curability of the cancer is based on picking it up early. We've said that over and over. And a typical example is if your house is going to catch fire, the fire may have just started as a candle that fell on the floor and burned some clothing and stuff. If you catch the candle as it falls down or before it gets too dangerous, then you can take care of this thing and you never have a problem. But if you allow this thing to fester and burn into a room, burn into the bedroom or whichever room you're in, and begin to raise havoc, there's no way you can stop that unless you have a very, very powerful water hose and have it immediately. So that I found was a good example to show the importance of early detection of cancer. So one of the myths we have is that once you have cancer, you're going to die. Well, all of us are going to die anyway, but it's not in that way. The cancer may not be what will kill you. So if you pick it up early, they say that 90% of the times you can survive it. And for example, cancer of the breast, which is the most common cancer, 90% of the people survive if they pick it up early. The second most common cancer is the cancer of the cervix. And with cancer of the cervix, it's almost 100% preventable. In other words, if you do what you have to do and take the tests regularly, you should never get cancer of the cervix. And prostate have a very high cure rate. So the thought that because you have cancer, it's going to kill you, that is not so. So you can dispel that. Although cancer is serious, but it does not automatically mean you're going to die from it.
I think the worry comes from the statistics that we hear. For example, when, maybe the medical fraternity will come out and say, well, St. Lucia ranks number 1 or number 2 in this, that, and the other. So I think when people give those statistics now, but I think we understand the point that you're making, that if there was early detection, we could avoid that sort of situation.
Yeah.
But I think it's when we hear the statistics, I think that's when we begin to feel as though, well, it's almost inevitable that cancer.
You don't have even though so when you get the cancer, you really don't have a chance.
Right.
So you better just give up or enjoy the rest of the life that you think you have.
As you said a while ago, we're going to die anyway.
Yeah,
That's
right.
what you said.
So in terms of the other misconception is that, cancer usually causes pain, so if it's not painful, then it's not cancerous or it's not dangerous. Well, pain is a protective reflex. If you didn't have pain, you'll find that you will knock your toe and didn't know. A nail will prick you and you will not know, and so forth. So many things can happen to you. You can damage yourself and don't know. It's the pain that reminds you were there. So pain does not mean, the absence of pain does not mean it's not serious. And many people, especially those who are diabetic and who have some nerve issues, find that the sensitivity of the sole of the feet is not very sharp. So they can get bruised and don't even know. And that's why they tell them, don't walk, if you're diabetic, don't walk barefooted, especially in the open area where things can prick your foot, etc. Because you may get an infection and don't even know. And that's how many people get their legs cut off, etc. But that's for a separate show. But the show today is that it is the awareness of cancer, and that because the cancer is not painful does not mean it is not dangerous. As a matter of fact, most times you see a lump in the neck or a lump in the area of the chin or around the two sides of the neck. Most of the time, these things are not painful. If it is painful, it's infective and most likely not cancerous. But the non-painful one are more serious than the painful one. So that's something that they should know. So the absence of pain does not mean it's not a serious problem.
Let me ask you a question, Dr. Surage. Would your body give any kind of indication that something may be wrong in every situation? In other words, something may be brewing inside our bodies and we don't quite know, but there's something, some sign, something, but we're not aware that these are the signs, because as you said a while ago, there may not be pain.
Mm-hmm.
So how would the person now know something may be brewing?
Okay, the way you can know is, though you may not feel anything, you may not feel pain, you may not feel feverish. And fever is a funny thing. If you worry about fever, invest in a little thermometer. Thermometer is not expensive to measure that temperature you're talking about, because many a time your body temperature you may feel it's elevated, but it's not.
Mm-hmm.
So I think that is something to have, to check your temperature. However, if you have a cancer, there are certain things that begin to happen. You may have a...
I'm sorry, Dr. Surage. I wasn't only zeroing in on cancer. I'm saying, would the body give any, because in the absence of pain, because you're saying we tend to judge these things by the amount of pain we may be feeling. So if there's no pain, we figure we're all right. So I'm asking, in every situation that you could think of in terms of illness, does the body give us any signs, apart from pain, that would indicate to us that something may be wrong?
Oh yeah, lots. You may feel lack of energy. You feel tired quickly. You may feel that the slightest pressure you put your muscle on, you're not achieving what you have to achieve. You may also feel that you may get headaches, or we said let's avoid pain. Okay, you may find that your appetite may go down. You may find your bowel motion, your stool is not coming regularly, and sometimes several days, and then you're not too sure what's happening. You may find you have diarrhea. You may see blood in your stool. You may see blood in the urine, and they always tell you every time you wipe, make sure you look at what you're wiping off, because you can have blood and don't know. So there can be blood, there can be in the stool or the urine, or you can find the urine stream may be weaker. You know your body and know when things are changing. And you may find that you have difficulty swallowing. You may have hoarseness. In fact, not too long, this week I met a patient who had been hoarse for about three years. And said, well, maybe it's a little thing I have. Maybe it's a little mucus. And look for all excuses, only to find out there was something serious happening. So although the person have no history of alcohol, no history of smoking, but you can still get these things. So hoarseness, anytime you have hoarseness in excess of 3 weeks, don't consider it to be just a hoarseness. Let your doctor examine, give you some medication, some antibiotics, and many a time it's acid reflux that's causing it. And so take some medication, but if things are not settling down, then you know that it may be something that needs investigating.
So I have a follow-up question, Dr. Surage. What would you suggest now to somebody who's listening to you right now and experiencing some of these symptoms that you just mentioned? But, they're not sure as to what's going on, but they're experiencing, as you said, the lack of energy, they're feeling unusual headaches, they notice the bowel movements have changed. So what should be your first call in terms of going to see someone who can probably diagnose your situation? Because you don't know exactly what's going on with you. You don't know. You just see headaches or something, and you have to ask yourself, well, who do I go to see?
Well, if you're not too sure who to see, then you go to your general practitioner. That's a good place to start, because they have been trained with an exposure to all the specialties, and they would have known which section you belong to. And they may even go further and begin to do the basic tests, so you don't waste much time when you go to your specialist. So they may do blood tests, etc., and so forth. So if don't take it onto yourself and unless you are sure, to go to specialists, because you may end up spending longer from one specialist back to a next specialist and thing.
Mhm.
So and it has cost implication as well. So I think that if you can identify your problem to a particular anatomical area,
Mhm.
like throat, like eyes, like nose, like urine, like stool, like private parts, whatever,
Mhm.
you've identified there,
Right.
then you may feel justified to see
A specialist.
a specialist one
Mm.
time.
Mm. But if you have
it is vague,
some general,
yeah, like you don't have appetite, you feel a little imbalanced, don't know what's
Mhm.
happening, and if you feel as though you are losing weight because your belt is not strapping, is not hooking where it's supposed to hook, is a little tighter,
Mhm.
it's a little loosener. So all these are things that you have to like somebody said long time ago, you have to know yourself.
So the first port of call you're suggesting would be a general practitioner.
Yeah.
So here comes another question, Dr. Surage. From what you know, your experience with doctors and so on, don't you think that the general practitioners tend to try to treat the problem themselves before they would recommend you to a specialist?
Well, they would probably give you first front line treatment. I think when it doesn't happen all the time, but generally speaking, when the practitioner recognize that the treatment is beyond their scope of capability, then they would refer you on. Not because it's a specialty that other people cannot treat it, because they are common things, like for example, a tonsillitis, inflammation of the tonsil, infection of the tonsil. From the time you start medical school, you see these things. So you don't need to be a specialist to treat that.
Mhm.
However, if you treat the tonsillitis and it's not going away, it's not getting smaller, it's still looking big, and then you say to yourself, well, perhaps it's maybe not just a tonsillitis, that's the time you should refer. And I think most of them do, although unfortunately sometimes the patient find themselves to us
Mhm.
and feel very upset that they were not referred.
Mhm. So, yeah, go ahead. Well,
So they end up coming at their own volition,
Mhm.
and they would say, well, if only I was referred earlier, especially if a lot of time has passed and then the thing has gotten complicated. They say, Doc, you mean I have been going to my doctor, and maybe not only one and another, because once we have a bad habit too. When you go to the doctor the first time and he gives you medication, if you did not take care of the problem, they tend not to go back there, they go somewhere else.
Mhm.
And the new doctor will start from the same page that the other one start. So you find that you are doing yourself a disfavor by jumping doctors. Go back to the same one. He would have known what he did before, or he or she, or he would have known where to take over and may refer you faster.
Now, because of all kinds of, doubts, lack of trust, things like that in doctors, and this is a reality.
Mhm.
You speak to the average person and they feel as though they will do better if they do their own research. And since the advent of AI, many people have been going online and asking, saying, I've done it already.
Yeah.
What would cause such and such a thing, and blah, blah. There are lots of people who do this sort of thing. And also, the first cousin to that is self-medicate,
Yeah.
right?
Yeah.
We're going for bush medicine and this sort of thing. So, Dr. Surage, what would you suggest? Because there's that lack of trust that people have in doctors. Sorry to say it.
No. I mean, you are representing the
Yes. Okay.
the public.
There's a general lack of trust. I think it has to do with people saying, well, okay, I went to see such and such a doctor. They had me there for how long, and I didn't. They were just taking my money. You heard those things.
Oh yeah.
You heard those things.
Doctor, yeah.
I see you know it very well, Dr. Surage. Yeah, so that's a problem. That is a problem. That it's amazing how we prefer to believe what AI says. And let me tell you about the AI. There's sometimes AI gives you some very good advice.
I think so. I think generally you're more likely to get good advice than bad advice. And I think that to a large extent, I have looked at things on AI as well.
Yes.
And
so now people are caught between a rock and a hard place, because what do you do?
Well, I think...
And keep in mind, Dr. Surage, that a lot of people are afraid of the costs involved, because sometimes, and I've heard the stories already, I've gone to see doctors so many times. I've done all kinds of tests, and they still don't know what's wrong with me. I've heard that already.
Yeah, that may be true. It could be that there can be many reasons for it. You have to assess it on its own, each individual merit. But I think that if you go to your doctor and you find that you're not getting the satisfaction you want, you have to go back and tell your doctor how you feel, and tell your doctor, is there anything else, or if you want to refer you to somebody else. But many a time, it is not that the doctor is doing something wrong. It's just that you don't understand what he's doing.
Explain that.
Meaning that maybe he thinks of, maybe you have a leukemia. You look well, you look fine. You have waist pain, back pain. You have a few other issues. You're looking a little pale. You fainted once or twice. All these are so generalized that it doesn't point you to one particular direction. So, but they have not done some of the tests they're supposed to do, because you're just coming in. They don't throw tons of tests on you. They will do a few tests, the more likely things, and look for the result and give you some medication in the meantime. So you find that a time comes when you have exhausted that, but time has passed. There have been review visits, etc. But it's just that your particular problem is a complicated problem. And the most you can say is that, oh, I wish I had referred earlier on, but you didn't know, because the person's complaint can be passed for many, many different problems. So if you say you are weak, man, tell me the number of things that make you weak. And if you say, well, you feel you don't have appetite, well, appetite come and go. So all these vague things take a long time. And sometimes they have nothing. They're just worried, they're just this and that. And so but there's no test for the mind. And therefore, they may have fear, they may have apprehension, they may have lots of other things that you may not even have thought of. And so you find many times they would say, well, I keep on going to the doctor. Now, if you had something serious, like something that is malignant or something that is cancerous, sooner or later, it's not going to remain that way. Things going to happen. And so you can see why sometimes there are delays, and sometimes it takes longer for things to happen. Because remember, it's a human being you're dealing with. Sometimes they may tell you what they consider to be important in their scheme of things, but there are many important things they may not have told you unless you ask specifically. I'm telling you, for example, somebody for ringing in the air. This person has been working for some time in an area where they shape the metal in forgery, and high loud sound emanate from that. And but these people have gone to other jobs, and they have less stressful jobs, but at the same time they may have forgotten to tell you, but that's the cause of the problem. And so you find that you, as a doctor, you have to be able to extract that information from the patient. Now, AI may not be able to do that as accurately as you can. AI put the figures together. They can pull information from everywhere for you and give you a nice story. And but the human touch is important, because there are basic things that you can see, etc.
Hey, Dr. Surage, I'm sure you know that many St. Lucians believe in things like the bush medicine and so on. I was talking to two, when I say young ladies, probably early 30s, somewhere around there, or mid 30s, somewhere around there. And they both came out with 2 bottles of something and saying that, this is what they drink whenever they feel like their blood pressure has gone up. or it's too low, or maybe the sugar is high. And they said to me, this is what they drink. And each of them has a bottle of this thing.
And it's doing them well.
Well, so they say.
Right.
So they say.
But I've always believed that there is wellness medicine and there is sickness medicine. If you are truly ill and have serious problem, you would need a kind of evaluation, monitoring, and treatment that will get you out of your problem.
But do you think, Dr. Surage, this kind of attitude, depending on these natural, well, we call them natural remedies and so on, maybe stems from this whole thing about being poor, that people don't have the resources? They feel like, if I have to go to a doctor and to pay the doctor, especially a specialist, to test, you hear people who say to you, boy, I spent over $3,000 on tests. You heard those kinds of stories. So when people hear those things and they know they can't afford to go, because out of fear that if I do go, I'll be told, well, you have to do tests and this sort of thing. And sometimes they do the tests and, the doctor says, all right, well, there's nothing here. Now I'm suggesting you do this other test. That's all. Do you think that poverty plays a role in that as well? That these people figure, you know something, let me just do my own thing and whatever happens, happens.
Well, I'll be talking from the top of my head because we have no research to prove that. However, I would say that poverty may have a role, lack of money and resources do have a role to play. But do not discount the fact that many people who are wealthy still enjoy their bush medicine or their thing.
So you mean even they're also reluctant to go see a doctor? That's what you're saying?
Well, a lot of it depends on the personality. Some people are viewing the doctors with a certain amount of skepticism. Others believe that, look, man, let me check my doctor before I take any of these things. So we do have people like that. So it's a wide range of people. And however, I believe that if the medicine took care of you, then really is your body, because the body has tremendous capacity to heal you and to take care of you. However, you must know what the problem is and assist the body with medication, with rest, with all the different things, of maybe by not using the limb or whatever it is. So whatever the situation is, I think you need to consult your physician to know how best they can help you.
I want to ask you a very important question before we take the break. Do you believe that there's medication to cure? Because again, a lot of our people believe that the medication we get does not cure the problem. It just sort of treats it, and it's always there, right? So would it be safe to say that medicine, meaning modern medicine, right, pills and so on, have, in maybe not all instances, but have the power, call it that, to heal completely? In other words, if I have this particular problem and I go see the doctor and I'm properly diagnosed, and the doctor says to me, all right, you take so-and-so, 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 can I expect the medication to heal me of the problem?
Well, depending on what the problem is. If you have a tonsil infection and it is paining you, it is swollen, you can't swallow, your saliva is drooling, you have pain, you have discomfort. And the doctor tells you, well, you have an infection of your tonsil, I'll give you antibiotics and it will take care of that. You take the antibiotics, within a week you're better, you can eat, you can drink. By the second week, you didn't forget you had it. Now, would you consider that to be healed? Because it can happen again. So we have healed that episode. Because you still have the tonsil, we can never tell you it's not going to happen again. And when it happens again, we will treat it and heal it again.
Okay,
let me tell you that if you remove that tonsil, it will reduce the frequency of these infections. Because
we have this thing called vertigo. A lot of people are complaining about vertigo. Right? Now, as far as you know, is there a treatment for vertigo or maybe there's not.
There are
So,
several,
so I'm asking that because if somebody were to come to you as an air doctor, right, because we understand vertigo has to do with the airs and whatever mechanism is involved, right? And you diagnose this person, yes, you have vertigo. Is there now? And we understand what you're saying. It doesn't mean it cannot return. I get that. But at the moment there, when you prescribe the medication, is it that there's no cure for vertigo, and you have to be maybe honest and say, hey, there's no cure for it, for what you have there, but I can give you something to, some of the symptoms would subside, that sort of thing, right? So what I'm asking is, if in the event that somebody comes to you with vertigo, and there is a particular treatment, can this person expect now, after they take that treatment, at least, as you said there for the time, that the vertigo is gone?
Well, that you can never guarantee. Because the vertigo can be caused by many different factors, one of which is the balancing part of the air is made of, if you can imagine a gelatin that is floating and there is some calcium or chalky deposit on the gelatin. So when the head moves, and that is floating on a water medium. So when the head moves, the gelatin shifts, and the calcium, the chalky deposits shift on it. So when you move your head left, right, it shifts differently. Up, down, it shifts differently. But just imagine that what I have described to you with the gelatin, there are nerves that are like tinier than a strand of hair, maybe 1,000th of a strand of hair. These nerves are passing through the water, through the gelatin, and through the calcium deposit. And so any head movement you make, that little hairy nerve will shift one way or the other. And whether it shifts left, right, up, down, etc., the other side shift the same way to complement it. If you had an accident where the chalky deposit falls off, and therefore it disturbs the equilibrium there, you'll find that when your head moves one way, what one ear feels, the other ear is not feeling it. And that disparity tells you you're not in balance. And you try to take action to restore your balance. And this is the vertigo. So
I come to you with that.
Right. So
I'm expecting you,
that,
and I'm hoping that you can.
Yeah. And there are many methods you can use. You can use what we call a repositioning exercise. It's written very clearly in YouTube, where you sit on a bed, turn aside, and turn your head the other way, and then you come back up again, called Apley's maneuver. And so that can help. It can help you to restore some of the chalky deposit back where it's supposed to belong. Secondly, you can take medication to numb the sensation, so when the dizziness comes, it's not so florid. You don't have all the different things. So in other words, they can treat you to make you functional again. Now, you can never guarantee to what extent you can cure that person with that
particular condition.
Right.
But are there conditions now when we come to a doctor that we get medication, the medication heals you?
Heals you from that problem?
Yes.
At that time?
At that time?
Yeah.
Yes, okay.
Yeah.
Okay, Dr. Surage, we'll have to take a little break.
Okay.
And when we come back, we'll open up the lines and so
cancer.
on. Yeah, we have to open up our lines, and hopefully, I'm sure our listeners will have some better questions, even more challenging questions than I have.
Okay.
Okay. So let's take a little break. This is Doctor in the House live on REV-UP St. Lucia 95.9 FM with Dr. Leonard Surage. The program brought to you with the compliments of La Place Salaison, Jeannot Cooperative Credit Union, and Tapio Hospital.
Tapia Hospital Radiology Department offers 24-hour service. We provide you with X-ray, CT scans, and ultrasound imaging using the most modern equipment that produces the best images for your medical attention. Call the Radiology Unit at 459-2201. Tapia Hospital, where the patient safety comes first.
In the heart of St. Lucia, where mountains meet the sea, there's a story of resilience, community, and a promise kept for over 50 years. Jana Credit Union has been a pillar of support and a friend. Together, we've weathered storms and celebrated triumphs, from sponsoring local events to supporting education. Our motto, together we can move mountains, isn't just words. It's a commitment to unity, progress, and shared success. Feel the pride, the belonging, and the warmth of a financial partner that cares. Join us and be part of something extraordinary.
It's delicious.
La Plaza Salazar is the true home of quality meat and deli products, selected and priced to suit every palate and pocket. We sell all cuts of meat, poultry and fish, from tasty lamb necks and succulent pork chops to lean dolphin and juicy top round steaks. Our deli items include turkey, ham, bacon, pork sausages, meat patties, chicken nuggets, deli ham and eggs, so that breakfast or that party is a breeze. And for your added convenience, we sell restaurant essentials and grocery items. So where's your next meal coming from? La Plaza Salazar, of course. La Plaza Salazar, Castries, Groselet, Beaufort, and Soufrière.
It's delicious.
Welcome back to Doctor in the House, live on REV-UP St. Lucia 95.9 FM. Your host is Dr. Leonard Surage, and Doctor in the House is heard and seen on REV-UP St. Lucia every Tuesday from 6 p.m. to 7 p.m. So those of you who'd like to call the program, the numbers to call, the fixed line is 572-9710, 572-9710, or the WhatsApp platform, it is 2870971. WhatsApp is 2870971. I'm here standing by to take your calls as soon as you give us a little shout. So, Dr. Suraj, it's back to you.
Thank you once again, and welcome listeners. Thanks for staying on. And while we were taking the break, I was reflecting on a few things. One of it is the position of herbal medicine in the treatment of cancer.
Mm-hmm.
And the general research is showing that there's no herbal treatment that has been scientifically proven to cure cancer alone. That alone. It can be added on for symptomatic relief or whatever, but it alone has not shown to cure a cancer.
So you're saying, if I understand you correctly, herbal medicine, bush tea, as people are calling it, alone will not cure
Your
cancer. As you said, it can be taken along with other medication.
Yes. So it has its role in being able to make you more comfortable. But the medical treatment is essential to see if you can cure your cancer.
Okay, so you said that's according to research.
Right.
You have a call, Dr. Suraj. This is Doctor in the House live on REV-UP St. Lucia with Dr. Leonard Suraj. Yes. Good evening, caller.
Good evening, Andre. Good evening, Dr. Suraj.
Yes. Good evening. And how are you, sir?
I'm okay. Fine, thank you.
Let me just get this.
Okay, that's good. That's good. Dr. Suraj is having a little difficulty there with the headphones.
Right.
Okay.
Okay. Sorry about that.
You there?
Yes, I'm there. Sorry. So let's hear you, sir. Thank you for calling.
Thanks for accepting my call.
You're welcome.
Yeah.
Okay. Dr. Suraj, as a man, I'll talk about prostate. When someone has cancer, for example, prostate cancer, you hear, I haven't heard it from any doctor, but from John Public, you hear that. Like the cancer, prostate cancer, like you hear the cancer has spread to the person's bones. Is that really true?
Yeah, very true. The different cancers have the potential of spreading differently. In other words, before I answer your prostate cancer,
I'll listen on the radio. Yeah.
Okay.
Thank you. Good night.
Good night. Every cancer has its own peculiar behavior. Cancer of the thyroid behaves different from cancer of the prostate, behaves different from cancer of the cervix or the uterus, etc. But the cancer of the prostate begin to grow inside the prostate, and the prostate is that gland that surrounds the neck of the passage of the urine at the base of the bladder. When the tube comes from the bladder into the penis, that part is wrapped around. As soon as it leaves the bladder, there's the prostate wraps around the tube, and it can narrow it down and give you a weaker stream of urine. The enlargement of the prostate can be generalized, or there can be a small focus that can start the prostate to grow. So you need to know, from the beginning of getting urinary problem, say like the flow of urine is getting smaller and smaller, you need to see a doctor. They may do ultrasound to find out if you have enlarged prostate, or if certain part of the prostate is more enlarged than others. And if you have a cancer of the prostate, it will begin to grow, and a time will come where it will spread outside of the prostate itself, in the tissue around it. Once it begin to happen, then you may find that you may be able to spot it in the blood, called the PSA. So the PSA occurs when the prostatic fluid or tissue end up in the blood. And so and after spreading, there are many ways that the prostate can spread. Through the bone is a very common way for it to spread. So the caller is correct in the sense that many times the prostate cancer spread into the bones. Excuse me. Yeah, and sorry. And that spread can be immediately in the pelvic, in the waist area, or it can be further back. Sometimes it can end up in the lungs. Sometimes it can end up in the skull. So the prostate have an affinity for bone, and it can spread there. So yes, that can happen.
With the prostate
cancer.
That can spread to the bone.
Yeah,
I've heard about that. I think cancer of the pancreas spreads to the bone.
Yeah.
So you say prostate
can do it too.
So it's also possible.
And as I said before, the most common cancer is the cervical cancer, the breast.
And that's it in women, are you talking about?
Women. And after that is cervical cancer in the cervix, prostate, and colon. So these things that are these are the more common ones. I wanted to say a little bit about this to remove a myth that said that if somebody have a cancer and you cut it, you almost make it spread. You worsen.
Yeah, I've heard people say, if they, I'm just quoting, once the doctor opens you, that's it just spreads.
Yeah. There are a few things that we'll have to address on that, and that is, in modern times, we have so much more information with CT scan, MRI, etc., about the size of the tumor inside your belly, that we can pretty much know how bad it is. However, most times when you get in there, it may be worse than you think, and may be difficult to remove and this and that. But this is not in the majority. What we do sometimes is take an exception and make it the rule. By and large, most times, when you operate, you're operating to see if you can achieve a cure for that person, or if you can make their quality of life much better than it is. So yes, the cancer can spread, but what I want to dispel is that when you operate on somebody, if you remove all the cancer, then there's no problem with healing because you removed everything. And however, sometimes when you take a sample, you may find that where you take the sample, it may be such that it may cause the tissue to grow. But if you know that, then you remove everything. You don't leave anything behind. So that's the answer for that one.
So just to be sure, Dr. Surage, the saying that if a doctor decides now to go check you out because maybe there's some cancer of they suspect it could be cancer of the pancreas, for example, and the doctor goes there, takes you into surgery, the fact that the doctor is going to do some kind of incision, right, okay, and the doctor separates the flesh to go inside there, that this now causes the cancer to spread. You're saying this is not true?
No.
All right.
It does not make it spread. You may find that what they found inside is far more than expected. And therefore the problem is graver because to remove that, you have to remove other things it's attached to. And it may be attached to bowel, it may be attached to bladder. So you have a challenge.
So the spread of the cancer, whether it's to the bones or to the wherever it goes, this is a process that takes place within the body itself. It has nothing to do with any outside force like a doctor going in there.
Yeah, it is the natural behavior of that cancer. It behaves in such a way, it grows and grows and grows, spread in the blood, spread around it, spread in the bones.
So while you're at it, Dr. Surage, let's dispel another one, that we are all carrying cancer cells. And when our immune system is weak or weakened, the cancers begin to thrive. So are we carrying cancer cells, or are we carrying cells in our body?
We're carrying cells, and the cells have the potential to do anything.
To turn cancerous.
Yeah. And if
you said to do any? Oh, sorry. Let me get that right.
Anything it can, because when the cells come from the bone marrow, it comes as a blank cell, and it may end up being a white cell, a red cell, and all different type of cells. So, depending on the demand, it might be one way or the other. However, they are not formed as cancer cells. It is the situation, whether it's genetic, whether it is environmental, whether it's exposure to different things, will change that cell from a normal cell to a cancerous cell.
So there are things taking place within the body, as you said there, that would cause that to happen. Yes? Certain things that are happening inside the body.
Like the immunology, the immune system may be weakened and prevent the cell from fighting other agents like bacteria and different things, and can make the cell turn into cancer.
So there's no one factor determining the cells becoming cancerous.
No.
So I guess that would make it kind of complicated, right? To explain, for example, to a patient who may say, "How did I get this?"
Usually people who have cancers, maybe there could be a genetic part to it. There could be an environmental part to it. There can be things. For example, if you were smoking and you were smoking for a long time, there's a chance that you may get cancer of your lungs. However, there are many people that smoke and never get it. So similarly, there are some people, painters, who when they are painting, they usually take the brush and put it on their mouth between their lips to fine tune that the tip of the brush, and they expose it to chemicals, and they develop a cancer on their lip. And there are people of Caucasian extraction exposed to our lights and develop many cancers of the skin. So these things are environmentally induced because the potential is there, except by it never express itself.
You have a call, Dr. Surage.
Hello.
Hello, Doc.
Hi, good evening.
Me again.
Welcome back.
Yeah. Thanks for accepting my call.
You're welcome.
All right.
Yeah. Dr. Suraj, cancer in the cervix is the same as cancer in the womb?
No. The cervix is the neck of the womb. To me, the best picture I see is, a pear, a zaboka.
Yeah.
Yeah. The body of the pear is the womb. And the stalk is the cervix. That's exactly how it looks.
When you say the stalk, what do you mean?
Where the
picture,
the thing is attached.
Oh, okay.
Yeah,
Okay.
The stalk.
picture,
Yeah.
Right.
Where it's attached. So when you take it out, you'll see a little dimple. Right.
Yes.
Right.
So
Okay.
this is the closest I have seen to what a cervix is. So that would be the cervix, and the
womb.
and which is called the
pear.
neck of the womb.
Mm-hmm. Right.
And so the rest of the womb is the body of the pear.
Then
So you
My
never
other-
see a pear in the same light again, right?
But it's the neck of the womb. So you're trying to imagine, of course, the womb as a neck.
Yeah. So you see, the body is round and there's a thin neck. Yeah. Yeah.
Oh, okay.
And that's
so
the
the woman and
cervix.
cervix are
Yeah.
different.
And they call it the neck of the womb.
Mhm.
Yeah. In
okay.
in general language.
Okay. My other question, Doc.
Uh-huh.
When breast cancer mostly common in women,
Mm-hmm.
when a woman has breast cancer, diagnosed with breast cancer, is it the milk in the breast that is contaminated?
That's another myth.
Yeah,
Dr. Suraj?
no, he's a very searching fella.
I told
He asks
you.
questions. He's always thinking.
Or is it the? Let me finish. I'll listen.
Go ahead.
Yeah, I want to know if it's the milk in the breast that is contaminated, or the blood vessels in the breast that is affected. I'll listen on the radio.
Okay.
Thank you
It
for your
is.
question.
It is none of the two. What is happening there is that it has been found that women who have breast cancer, they usually have a long period of hormonal bombardment of the breast by estrogen, progesterone, and this can happen when they have early period and they have no children or few children and so forth. They are more likely to get breast cancer because every time there is pregnancy, the pregnancy tend to protect the breast from some of the hormones. So for 9 months or so, the hormones are high, the breast get protection. So if you have had no children, then the exposure to these hormones are more.
So what if you're barren?
Well, barren means, well, yes, because you have no children.
Mm-hmm.
Whether the children, not having children is because of hormonal, there can be many reasons why somebody doesn't conceive. And however, the lack of conception exposes the cyclic period monthly to have more bombardment of the hormones to the breast tissue, and that is what is actually has been associated with it. There is a genetic basis. Some family, it runs more in families. It's also, there is an association, not a cause, an association between long hormonal exposure and the chances of having a breast cancer. So it's not the milk. The milk doesn't get turned and cause that. And what he was saying again, but generally, no, it's not the milk causing that. It is the hormonal influence.
Mm-hmm. So I guess getting pregnant is something that works in the woman's favor.
That's right.
That's what I was asking. If the person, not their fault, they happen to be barren now, the woman is barren, how does that affect them? Because it's not their fault that they're barren.
Well, you see, barren will not cannot be used in an argument, because in a discussion, because barren is a colloquial term, or not colloquial, but international. It's just saying that you can't have a child.
Right.
Now, in modern time, the gynecologists and them will not see it like that. They'll see an infertile couple. Because 50% of the chance is the man that has a problem, 50% is the woman.
Okay.
But when a partnership exists and children cannot be conceived, automatically they over-investigate the woman and leave the man scot-free. And sometimes it may be him who has quality of sperm, number of sperm and whatever. And maybe the work he does, the kind of underwear he wears, all that can cause the heat into the testes and reduce the number of sperm.
I get your point, Dr. Surage. Yes. So you said sometimes I think it is assumed that because the lady cannot, conceive, it's her fault.
Yeah. And so when you say barren, she may have proper cycle.
Right.
In other words, that the hormonal changes do occur every month. But she just cannot conceive for what other reason. And so she.
So you say it could be the result of the male now.
That's right.
Not being able to
effect the conception.
Okay.
So that was what I wanted to say on the herbal thing, since we mentioned it earlier on. The cancer, some people think that cancer, if my parents have it, I have a higher chance of getting it. That doesn't apply to all cancers. Some of them are not hereditary. And I don't want people to believe that they are a lost case, in the sense that their parent had cancer. There are some cancers that are more likely to occur in a hereditary kind of way. I think prostate cancer is one of them, and because it's marked in the genes, and that can cause them to have cancer. It is said that between 5 and 10% of cancers are hereditary, not 50, 60. So the figures are small. But I wish to say also, with all the hereditary aspect of cancer, the other factors that cause it, if you control it, you can reduce that probability tremendously. Let me put that in ordinary language. If your father had cancer of the prostate, there's a higher chance you may get it. But if prostate is a bad example, because there's not much you can protect yourself against. But if it is, say, lung cancer, somebody had lung cancer, there's a chance of you may getting it. But you decide, I am smoking, I'm not staying by anything that will increase my chances, and I'm going to, if I have a cough or whatever, I check. You can reverse these statistics by environmental and exposure.
But would that be in some cases?
Well, in all cases, you can reduce it by, if you know the things that can cause it and you avoid it.
Because let me just explain to us, Dr. Surage. When we talk about heredity, is this something that either the man or the woman, right? Say for example, you have a father who is a smoker. Okay, he's a smoker, and he started smoking at age 40, and he had children at age 30. Okay, but he has cancer now at age 40 as a result of the smoking. And assuming he has a child now at age 40, I hope I'm not confusing you.
No.
So since we talk about heredity, right? What happens in a case like that? Would you say it's not the smoking maybe that caused the problem, right?
Oh.
So who's more at risk of if we're talking about heredity? Who's more at risk? The one who was the child at age 40 when he developed cancer and he had that child at that age, or the one at age 30 when he didn't have cancer. So the whole issue of heredity would mean that if he developed cancer, there's nothing to say that he developed cancer because of the smoking.
Yeah,
it could just be that there's something maybe his father passed on to him, right? If we're talking about heredity.
Yeah, but the hereditary would be more the likelihood of getting it. In other words,
who's more likely to get it? The one who has the child at age 40 with cancer, is a smoker, or the one before? Are they both at risk?
Well, they're both at risk. But if I understand what you're saying correctly, the exposure when you smoke, and it is the way the lining of your windpipe deals with that. And if you have the genetic makeup where it can happen faster, so the person, the child, will more likely to get it if he is also smoking. So it is what I'm trying to get at is to understand exactly where your query is, because.
But we're talking about heredity, Dr. Surage. How does it work? How does it work? How do we know if it's heredity, right? And I'm living in the same house with this father of mine.
Yeah.
Okay. And he wasn't smoking at age 20, and he had me in his early 20s, for example, but he didn't have any cancer at that time.
Yeah.
And say, for example, he has another child in his 30s.
No,
but at that time, at the time in his 30s, he's developed cancer for whatever reason.
Right.
Whether he's smoking, not smoking, he's developed cancer. I'm saying, who's more likely, if you talk about heredity, passing it on for the genes, who's more likely to develop the cancer? Is it the one that when he developed it in his 30s, or the one that he didn't have it in his 20s? He has two children, one in his 20s, one in his 30s. But he developed cancer in his 30s.
But
if we're
he had
talking
one
about
child before.
Heredity. We're talking about in other words, that's what he's saying. You pass on things to your children. That's what heredity is all about.
Yeah, you're passing on the susceptibility or the chance of getting it to the child.
Which is greater? When you have it, or is it something that was already there?
It's something that was already there. Meaning that you being exposed to the smoke or not.
Because you gave an example a while ago. If you have somebody who smokes in your family, and you make up your mind, I'm not smoking, but your father was smoking, and your father developed cancer,
right?
So even if you don't smoke,
you have the potential of developing that from the genetic aspect of it. However, you have avoided all the risks. You're much less likely to have it than your brother who's smoking. Or if you all are two twins are better to work out because the genetics is better on that, almost equal. So your father had two children, you and somebody else, and one decided to smoke and one decided not to smoke. The one who smokes is more likely to come up with cancer than the one who didn't smoke.
But it doesn't mean that the other one can't get it.
The other one can get it too.
Right.
Yeah, for many reasons.
But you said one of them is less likely because...
Yeah, the exposure, that would be the environmental factor that's influencing that decision. So.
Now, is that so in all cases, Dr. Surage? Or there's some cases that is just inevitable, it's part of it's in the family tree, we'll say, so-and-so had diabetes, that one had high blood pressure, everybody, all the sisters, all the brothers develop high blood pressure, that sort of thing. And then now they have offspring.
Yeah.
And is it inevitable that the offspring, because you hear people say that my father had it, my father had sugar.
And I think that's what we always say, that, say like the diabetes, your father had it or your mother had it, and then the offsprings, they have it, their children feel that, what can I do to prevent it? Now, if the lifestyle changes, it changes all these probabilities. And that is why we keep on saying that the lifestyle is so important into preventing, avoiding these kind of chronic diseases. As a matter of fact, 2 people got Nobel Prize several years ago on what we call on the genome,
Yes.
where the genes were identified that with exposure and with environmental conditioning, the genes can actually change and create opportunities for cancer and other illnesses. So environmental factor and prevention and lifestyle is so important, even if it is to assist you in avoiding cancers. It can do that. And it's a combination of what you eat, your exercise, lack of exposure to excessive alcohol, smoking, and all these things. It's amazing the extent to which prevention can change the landscape of disease pattern in any country.
Yeah. The reason why I asked that question, because you hear people tell you, I found out I'm diabetic, and they will quickly say, my father had it, or my mother had it.
Right. And this is what I'm hoping that we can dispel, that you must not give up and think it's a fait accompli, knowing that your parents had it. I can understand how it makes you feel powerless, as if it is something that has overtaken me. I have no choice but to follow.
Yes.
And no matter what I do, it's going to happen to me. And this is what we try to dispel. The answer is no. Your parents may have diabetes or whichever illness. If you know the contributing causes apart from genetics, you work on that. You work on avoiding certain things, keeping fit, don't get too excessive on your drinking, and all the different things that you know can cause it.
Yes.
And if you and see your doctor, make sure that you are fit, and if you have any issues, see about it early. So these are very important to offset any disadvantage you may have.
Well, I think, Dr. Surage, that's a great way to end our program.
I think so too.
On that positive note.
Right. Well, thank you very much for having me here with you. And listeners, thank you very much. Caller, thank you for sharing your thoughts with us. You've always have some provocative questions for me. And next week we'll see you again, same time. Thank you.
So, Dr. Surage, one time I remember a friend said to me, am I chopped liver?
No, you're not. You have a long way to go, my friend.
Okay, Dr. Surage.
Take care.
Thank you very much. Have yourself a good night.
All right.
And as always, thank you for your service.
Thank you very much.
You're welcome. Okay, this has been Doctor in the House, live on REV-UP St. Lucia, every Tuesday from 6 p.m. to 7 p.m. with Dr. Leonard Surage. So thank you for listening and thanks for viewing. And the program brought to you the compliments of La Place Salaison Journal Cooperative Credit Union and Tapio Hospital.
At Tapio Hospital, we operate a 24-hour emergency service for all your urgent healthcare needs. Our qualified medical specialist will be on hand to ensure that you receive the best of care. Call us at 459-2617. Tapio Hospital, where the patient safety comes first.
In the heart of St. Lucia, where mountains meet the sea, there's a story of resilience, community, and a promise kept for over 50 years. Jana Credit Union has been a pillar of support and a friend. Together, we've weathered storms and celebrated triumphs, from sponsoring local events to supporting education. Our motto, together we can move mountains, isn't just words. It's a commitment to unity, progress, and shared success. Feel the pride, the belonging, and the warmth of a financial partner that cares. Join us and be part